Thank you. Now to the Health Minister, Dr. Zweli Mkhize, on the public health response to COVID-19, including the possibility of a resurgence.
Of the world, in particular in Europe. So we always keep an eye as to what's happening in the West because of our very close relationship. So we'll take you through in a form of a presentation, and I hope it's going to make sense. And as much as possible, we will then try and clarify a few things so that we can just move along together on this journey, South Africa. But at the same time, I just want to thank you, members of the media, for the reporting that you have been able to do over the past few months. It's really helped to keep the country, all South Africans, well informed. And so we will continue the conversation, as it were, at this point. So I'd like to start showing you a presentation, and then, of course, we'll open up for questions after that. Well, I'd like to take us through the latest of our figures. At this point, we have crossed the 750,000 mark in terms of total cumulative cases. I'd like us to focus on the slide as it's giving the latest as of today. The total cumulative cases stand at just over 750,000 positive cases in the country. We are reaching this point, of course, for the first time, but I think it's important to indicate that our numbers continue to grow. If you do look at the distribution of where the highest numbers of positive cases are, about 31%.
Sorry.
31% are in Gauteng, and about 17% in KwaZulu-Natal, about 16% in Western Cape, 14% in the Eastern Cape, and the rest are below 10%, with the Free State at about 8%. It's important to just look at those figures because I think we entered the wave with different numbers as well as at different times as different provinces. At this point, our total deaths have exceeded 20,000, which is 20,241. And then the case fatality rate stands at 2.7%, which is relatively comparable to what is happening in the whole world. The total recoveries are at 693, 467. That's equal to just about 92.3 or 0.4%, which is a very good recovery rate. And as we see, the active cases are 37,000. Now, this for us is the latest in terms of this situation in the country. I think it's also important to have a look at the journey that we have traveled. We started around the 5th of March with our first patient. Was positive. We've actually moved on now for 45 weeks. We're on week 45, and in the process, we've gone through all the stages, and at this point, we are at what we call level 1, with a lot of restrictions having been eased, and an effort to try and get to the normal as possible of our daily lives and economic activities. That's the journey that South Africa has had. You'll also note that the numbers started rising when we were at what was level 4. They went up, but even more when we went to level 3. That's when we experienced the surge from June to July. And therefore, at that point, we started seeing as the numbers also were declining. We did indicate over that period that our predictions were that we were going to have the surge but we're going to have the surge with lower numbers, which was very helpful for us to be able to prepare our health services to be able to contain as many of the patients as possible. As it happened, we never ran out of beds, we never ran out of oxygen, we never ran out of ICU beds or ventilators. In fact, most of the equipment, the ventilators, were not actually used there. So we made provision which was adequate to cover the situation in which we were. This graph, you might recall, is an indication of where we started, and then all the surge is showing, the different colors are showing us different provinces, with the highest surge being with Gauteng, and of course followed by KwaZulu-Natal, and then Eastern Cape and Western Cape. This pattern, as you realize, started early in June. In fact, in the Western Cape started in May. But over that period, the peak were at giving us up to about 13,000 positive tests in a 24-hour period. And at that time, we were able to do close to 46,000 tests. And so this is an indication that we were able to cope with both the tests as well as we were able to also track for each and every province to be able to see what pattern was going on. Everything then went down until around the 30th of August. We will see that after that, everything went on to a plateau. That plateau has gone on up until the past 2 weeks. Now, it's important to say that that plateau didn't give us 0 patients. That plateau gave us, we dropped from about 2,000 positive cases per day, went down to close to 1,000 per day, but we started moving back to 2,000 positive cases per day. What you will notice also, if you look at that very busy slide, is that there are provinces which lag behind in their peak, such as the Free State and the Northern Cape, and also Limpopo and Mpumalanga, but particularly Northern Cape and Free State started showing higher numbers, which are part of the same surge, but happening a bit later. And so that pattern is important to note as we move on. But if you look again now on the 25th of October, all the lines were equal, lying flat, but then you start seeing 2 lines that are beginning to jut up. Those are the areas of our concern. And the one gray line that's going up is the indication of the numbers that have started increasing in the Eastern Cape. And then the one which is an orange line, slightly moving up as well, is the numbers that are already showing some activity in the Western Cape. Now, these areas are areas which we are now watching as indicating increased activities. Whereas when we look at this is a new phenomenon. It's not the same as what we are seeing in the Free State and Northern Cape, because there they got onto the same first wave late. But these two got into the first wave, went to a plateau, and they were stable, and then they're already now showing new activities. Those are the areas that I just want to talk about as we move on. But this is to indicate now that we have started seeing a little bit of increasing activities in the Eastern Cape and a little bit in the Western Cape. We can't yet say this is a new surge. We're basically saying we're now observing these areas, and it's important for us to share with fellow South Africans that this is what we're now seeing. Now, another area which I think should be interesting to all of us, you may recall that way back in July, as we're moving on to the peak, South Africa was recorded as number 5 in the world in terms of the highest number of positive cases found. We had moved quickly up. The rest of the world seemed to have been coming down, and so South Africa moved up. Then you will see that US with 11 million, India now at almost 9 million, Brazil at 5.8, and France at 1.9, and Russia at 1.9. But South Africa has been pushed down 3 weeks ago, South Africa was around number 10, and then of course you see that it has now been overtaken by Spain, UK, Argentina, Colombia, Italy, etc. And now we're at number 15. And if you looked at Poland at number 16, with the numbers that they were showing of new cases in 24 hours, within a few days, we might end up being number 16. If you look at the other countries below, if they keep those numbers, it's likely that South Africa might also be pushed further down to number 18, 17, or 18, depending on what's happening. But that actually is the point which I think is important for us to note. We were once much higher, and the reason why we went down, we went up, is because we increased our own positive cases more rapidly than any other part of the world until number 5. Now, this time it means the other countries are also increasing their positive cases faster than South Africa, which means what happened to us before, where we started rising fast, can still happen to South Africa again. And that's why we think it's important to share this kind of information, that the other countries are already experiencing a second wave, and that wave is pushing a lot of them up in terms of positive cases. We never got to a zero number, and in fact, some of the countries were even better off than South Africa. So it's important for us to keep a note of the fact that this pandemic is a very dynamic situation that keeps changing in different countries. The second point I think we need to note is that when we went on to the lockdown and we stopped international travel, we had actually had a number of people that come from a lot of these countries. So in other words, we do have a relationship with a number of the countries that are already showing an increase at this point. Now, if we can just move on. Now, I'd like us to pay particular attention to a number of countries. We will try and see if we can move slowly so that we can be together. The first graph on the top left says Peru. So if we follow what happened in Peru, the graph shows that they had an infection, then the pandemic went up and it peaked, and then it started a plateau. Then somewhere along the line, before it came to about 3,000 cases, it started rising again. You'll notice again that the second wave was higher than the first wave. And that's where they are right now. That's why they are higher than South Africa. We pick up the second one at the bottom. Bottom left is France. France had a wave, and then at that time it had lots of challenges, but then it came down to a plateau and everything seemed to be fine. And then in the past few weeks, France has started showing an increased number. At this point, their numbers are still increasing much higher than they were in the first wave. You go to the next countries. There's Spain at the center. Again, Spain had a huge wave, and then it came down. It came down to a much lower level, which gave an impression that they'd completely contained it. But then there's a surge. The surge is still rising right now, the second wave, and as it goes up, it's indicating that it's higher than the previous wave. And then USA is a similar pattern. First wave and then plateau and then went up on the second wave. It's on its way down. Italy, the same way, it's now rising again, in Italy. And then, of course, the UK is the same thing. I think the moral of the story here is that the countries that had infection, the pandemic started earlier than South Africa, have now gone into the second wave. And in general terms, the second wave seems to be higher than the first wave. And so it's something that we need to note because we only got infection much later than these countries. Of course, there may be a lot of different conditions that we have. Now, if we do an analysis on the week that ended just the last week, around the 7th of October, we were at about 737,000 of confirmed cases. If you compared with the previous week, you notice now that there was a slight decrease of about 18%. So we compare everything. We compare day to day. We compare week by week. We compare every fortnight and see what trends we're having. So there was a decrease of about 8% at that point, and compared to the number of new cases which were seen on the week 44. Then the fatality rate I've indicated is 2.7%. What I think is important to note is that we are doing a number of quite a high testing rate. Those 4 provinces are provinces where we're doing high testing, around over 200 per 100,000. And the reason why I'm indicating that is because the Eastern Cape is showing numbers going up now. So we are saying that we're still going to increase testing, but it does indicate that we're still testing pretty high together with the Free State. Free State is still in the first wave, and therefore they're on their way down, but we're still testing very high, including Northern Cape and the Western Cape. So it's important to increase the testing particularly as we begin to see the numbers increasing. Just as a matter of our own daily concern is the safety of our healthcare workers. We do want to indicate that at this point, 35,490 have actually been identified as positive, having been infected. And then the others who were admitted were 4,368. We unfortunately lost 338 of those health workers, and may their souls rest in peace. Then the others are discharged and transferred. So effectively, we just wanted to give an update, because we've had a lot of debate and lots of work done to try and make sure that our health workers are kept protected. And I think all of us recall as well that the president has actually said across the country, we're going to have to go onto a day of mourning to commemorate those lost lives. This is indicating that whilst we talk about Eastern Cape, actually the COVID activities is found in a number of different parts of the country. If you look at everything that looks dark red, you will notice that it's found in the Eastern Cape, but also some in the Free State and some in Limpopo, Northwest, and so on. So the whole country, we're doing a monitoring to see where activities are. And therefore, we'll also indicate to you that it migrates, depending on how it's managed. You move from one sub-district to another sub-district. But in this case, this is what we've got throughout the country. And so it's spread right across. So Pito, Western Cape, Ndlambe, Eastern Cape, and a number of them are in the Eastern Cape, of course, Limpopo. This is just to indicate that the distribution is quite wide, but there is quite a focus on the Western Cape.